Oh, this is the podcast studios brought to you by Machine Inc. Welcome, everybody.
Good morning, Sunita.
Good morning, Jonathan.
How you doing?
Very good.
Did you expect to be sitting here doing a podcast today?
Definitely not. This is just thought to be a discussion. We'll talk about it. You'll write about it.
Well, I'm glad to have you here. I'm glad you agreed. And yeah, thanks for coming. I haven't seen you in a while.
Yeah, it's been busy.
Yeah?
Yeah.
So I know that obviously we've worked together. You've been a friend of mine for some time now.
Yes.
And I know you're a doctor, but I don't know what kind.
So I'm a pulmonary critical care and sleep physician. So in the layman's language, I see people with respiratory problems. So that's the pulmonary aspect. And so these are like shortness of breath, COPD, asthma, and a host of other disorders. For the critical care, I work in the hospital in an ICU setting, patients who are admitted in the ICU, so I'm, care for them. And then I also see patients with sleep disorders. So these are excessive sleepiness, snoring, sleep apnea. So it's a clinic-based and a hospital-based practice.
So you're in the ICU.
Yes.
How is that? You said this is stressful. How can this be stressful?
Public speaking is stressful. ICU can be, it can be draining. So that's why, but at the same time, you are helping people through, their critical illness. Oftentimes, I'll see patients towards their end of life. So that if we have, many patients like that where we're kind of just transitioning them from life onto death, so to speak, that can be stressful because you're seeing a lot of it every day. But, in the middle of all that, there are others who come in with just, a critical medical condition that just needs support and then care, and then they leave the ICU. So that's kind of makes you feel like you've helped someone. Even the transitions, I think, are helpful because as I get older, I want to have that. I wish people would make that transition decisions easier for them. So I kind of thought of, look at the broader picture kind of thing. So sometimes, yes, it can be stressful. Sometimes it stresses me as I get closer to the age of my patients, I worry that, am I going to go through this? And how will I avoid from going through this? So as we joke among my friends, we have a do not resuscitate order. We do not wish to go through this and ever. So from the ICU standpoint, that can be stressful. So I balance that with my, my outpatient practice. So I've been in practice for over 20 years now. So some patients that I started seeing at my current job, in 2006, so it's almost 20 years, I have grown old with them. So, so that's the balancing part. I like that aspect of the long-term care. Sometimes there are some patients where, we chat about their medical issue for 5 minutes and the remaining 15 minutes is chatting about our kids and, so it almost like they're friends and also patients. So it balances out the critical care part.
Yeah, that critical care part, how much is it of your like day to see people kind of go through the transition? That's something I worry about a lot. I don't know why. I wonder about it. I'm not a doctor and I don't see it. I think a lot of people probably do.
I mean, I think I don't know. There are sometimes I feel families hold on to their dear one, thinking that I think there might be some guilt in terms of saying, don't do this, just let them go. because I guess there's always the fear that, maybe you are responsible for hastening the end, and sometimes people are not comfortable with that. I think the best that anybody can do is to discuss with their loved ones how far they would like them to go if you are, if they are in that situation. In the sense, like I will tell my kids, if I cannot come out of, this particular step, that's it. You don't have to go any further, because at the end of the day, when you are in your 60s and 70s,
Hmm.
the depending on what brought them into the ICU, so the quality of life, your family, your kids know what's important for you. So if your doctor is telling them that no, your mom is not going to be able to do all of these things, that's not going to be her quality of life,
Yeah.
and you know that your mother, it would be meaningless to me if I can't travel, I can't hike, I can't walk. So if that's where I'm going to be, then that's not the life your mom would want for herself. So that should make this decision easier. So I think most of the time I wonder, like the families that struggle, whether they knew what their mom, what their loved one wanted for themselves, or what is the quality of life. So oftentimes when it reaches that point, we have these family meetings where we sit down and we try to understand how, what was your, before all this started, because
Yeah.
everybody's stressed, they've been coming to the hospital for God knows how long. And then you ask them to sit back, even, coming like sitting here. It's stressful
Mhm.
to determine, to say, okay, step back, ask what your mom was like, what your father was like, and what is it that brought them joy, and what would they want their quality of life to be? Would they and everybody's different, some may just be happy being able to see their kids, and even if they're in a, let's say, a wheelchair, but that's not for me per se personally. So I think family know, and as people get older, I think they should make it easier for their kids and so on. Say, hey, not that I'm dying tomorrow, but if something were to happen, this is what I like, this is what I want to do. And if I can't get there, and if nobody can nobody can guarantee anything, but if you
Right.
can't get there, then feel free to say, you should stop. I don't want everybody, people can recover, can be, sometimes families say, oh, my parent was a fighter and they would want any chance they get. So that's a personality type that, if that's what it is, they can keep trying. But at some point, it does become more, to me, sometimes that's the sad part, that I feel like they're prolonging this individual and it's hard to see.
Yeah. Oh, for sure. Does you find like that having good medicine and equipment allows you the ability to keep people quote unquote alive, whereas like without it there really would not be a chance? Is it kind of more up to the technology nowadays to be alive, not necessarily
Yes.
having a quality?
Oh, yeah, yeah, definitely. I mean, there are many, many instances where I think, we would not be able to keep that person alive. We have systems for medications to support blood pressure, we have mechanical devices to act as substitutes for the heart, and we have ventilators to help somebody breathe, we have dialysis machines. So you can keep the systems working to a great extent, and which resource limited places, like underdeveloped countries, probably don't have. So, these are sometimes I feel like, I trained in India. So there, I mean, I think when I was doing my training, I didn't even, um, intensive care was not part of the medicine training. It was
Hmm.
more like the anesthesia surgery training, and we didn't have these devices. And so I have not seen an ICU. I mean, things are changing there now. So
Hmm.
after some of the treatments are not even offered. Like, yeah, if you're um, 85, I mean, you're not getting a bypass surgery,
Yeah.
because but things are changing, and so consequently, we have, surgeries that are offered to 90-year-olds, which, frankly, I wouldn't get even if I was running a marathon at 90, but that's me.
Yeah. So that's got to make it difficult because it really kind of puts the decision in the family's hands where maybe more often than not in the past, it just happens.
That's right. So, you come to the hospital for something and, maybe an illness, but they didn't anticipate ending in the ICU. So that's why I say that having this discussion, it doesn't matter how old you are, um, letting your near ones know, we don't always talk about this is important to me in my, life and so on, but just they have a good understanding of what kind of person you are and what gave you joy, and what would give meaning to continue going on. So, but sometimes you have to be really specific, and there are actually now advanced care clinics, and there are people who they can talk to their primary care physician, asking to have those things written down in the form of a living will and so on.
Yeah. That's stuff that as I get to be my age, find kind of that I'm being exposed to and bringing to my family and my father and mother and things. What is there anything you're aware of that like helps besides like a will where you have an attorney, like just questions that would be like beneficial to ask to get some clarity on how to make the right choice? Because maybe a lot of people aren't equipped to.
I don't think there are specific questions. I think if you trust the physician who's taking care of your loved one,
Mhm.
I mean, the main thing to ask is, can they tell you what is the quality of life, or what would be the next stage of this person? So, I'm in the ICU, in a medical ICU. So, sometimes there are patients who cannot get off the ventilator. So, they have to go to another hospital. They have to be connected to this ventilator and, be essentially bedridden. So that's something that we can tell them. So this is the next stage, and then from what your loved one wanted, is that something they would be happy with?
Yeah.
And so I know we don't talk about this, like this is not dinner table conversations, right?
Right.
To say, oh, do you want to live in a nursing home? But they do come up. As we get older, we do tend to think about these often because, illnesses and chronic conditions, we are exposed to. I keep telling my patients, you are like your car. You don't drive a 60-year-old car, but if you did, it goes into the shop a lot more often. So you have to
Yeah.
think about it that way. And then you have to decide, at what point will you keep fixing the car, or you just let it go. And so that's a conversation to, some people, I feel like because of my training and because of what I do, it's easy for me to bring these things up and talk about it. But I could see that some people are scared to die, so they don't want to bring it up. It's almost like you talk about it means you're going to die tomorrow. So that's where sometimes if the parent doesn't talk about it, the kids can, I don't know how this conversation would come up, but, just to know, what's important to them. Like, this is what you just heard. And, sometimes you might be put in that situation where someone's asking you, you've got to put your a loved one on a ventilator. Is that something that, you would want? And I think, parents don't often discuss their medical problems with their kids, but they
Yeah.
do have a primary care physician, so they can have these conversations with them. And my colleague who I work with will be very mad if I don't remember, but I don't exactly remember. There's the if the Polst form is what I'm thinking of, but so you
Mhm.
might have to delete that from this podcast. But I can add resources. So we do have
Mhm.
an advanced care clinic at our institution that people can sit down and kind of discuss in lay terms and kind of lay things down. That's I don't run that clinic, but my colleague who does, I am, what should I say, clinic mates with them. So I
Okay.
see who comes into their clinic, and so I see like the parents and the kids coming in, and together they are having this discussion. And so everybody's on the same page at that time. So that makes it easier. And these are people with chronic illnesses, probably, who are advanced illnesses that, at some point, sooner rather than later, they might be in that situation. So,
Yeah.
while they are so called healthy, having that conversation with their kids, makes it easy for them. It's always stressful, to ask a person as they are like deteriorating to say, do you want this? Do you want this? We don't do that.
Right.
We just assume you coming into the hospital for care, you assume everything needs to be done. But if they ever had any thoughts about, no, 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 this is not what I want,
Yeah.
that would have been helpful to know. So,
Ahead of time. Yeah. It seems like if you have chronic conditions, it's almost a luxury in the sense that you see things coming. So you can have the conversations and you kind of have those things written out.
mhm,
And if you don't, and you're kind of blindsided,
yes.
if you do end up in the ICU situation, I think maybe that's when it ends up being tougher on everybody, including the family, because they don't know like what's right, what's the right choice. It's a hard thing.
Yeah.
And I say this because I think it's funny, but there's like Catholic guilt or something where it's like you're afraid that you're responsible and you have this pressure and you don't want to do the wrong thing. And I'm sure that translates to all people. I don't think it matters your religion by any means, but it's probably a really good thing to think about, like well in advance, and have the conversation. I mean, as long as parents aren't throwing stuff at you.
Yeah, yes. Yeah, exactly. So I think, the best thing is to know what their wishes are. I feel like the guilt will come if you make that decision for them, not knowing what it is that they wanted, or suddenly faced with a situation where I don't know. I mean, would my parent would they be just happy to be awake and, interact even if they are hooked to a machine, or but if they can't even, um, if they're not even with it, like if they're not conscious enough, or they are, sometimes they're in a state of delirium from their disease and so on, and they're not really waking up, going back to where they are. Is that something that whether or not your parent would be comfortable with? So that's why I think having that some basis of a conversation decreases the guilt for all of them. And in larger families, I think that's where the struggle is, because it's like some kids want this, other kids don't want this, and then there are some significant others who have a different idea. So when you have such a family situation, those people, I think, really should have this talk, because that's where we struggle as, as providers and as physicians taking care of that patient. Like, oh, the brother wants this, but the sister doesn't. And it doesn't matter if, we often say that there's one person should be made, should have power of attorney for healthcare decision making. So that's a legal document. So yes, if that person has been designated, whatever that person decides is
What happens?
it's what should happen, because that person was designated by the patient as responsible for taking care. So if somebody else has a different, so therefore we assume that the patient trusted this person with
Yes.
those kind of decisions, and say they know they will make decisions consistent with this person's wishes.
Yes.
So that's another important thing to do, is to designate somebody if you have extended families and, a lot of kids, and, so.
I think it's what you said with having bigger families is a really strong point to make, because unless it's talked with the parents and then you have to discuss it kind of with your siblings, or you're all on the same page and only one person gets to make the decision, they're going to feel a tremendous amount of responsibility. And how can you really act in favor of, you're just not going to be able to. It's like no matter what you do, I feel like in some ways you're going to have a really hard time. I think probably really common.
Oh,
it
it's
probably
very
breaks people up.
common.
Probably breaks, it probably causes
Yeah,
a
we
lot of
see.
problems for
Yeah,
a little
I think
bit.
it can cause, rift in the families and so on. But and that's hard for me to see. I see that. I guess everybody's coming from a good place. They want the best for their loved
Right.
one. But as we, even though you grew up under one roof, but as adults, you have different opinions and you form different. It's not necessary. It's all the same. And um, and that's why I think then we wonder, and like, why did this person never assign one of their five kids with this responsibility? Why did they, when they knew they had cancer, when they knew they had, it's even when you're, you don't, I think it's helpful to have this laid out, have that conversation with your kids to say, yeah, you know, sometimes it's even,
Ba- Base.
complicated family situation.
Yeah. No, it is. I
Even
mean, how could it?
uncomplicated, yeah.
Yeah. How could it not be though? I mean, I would think it's probably very rare that things just maybe from a doctor's standpoint it kind of goes smoothly because what they see is very diverse. But it's got to always be rough waters, I'd imagine. I mean, to some degree, maybe not. Maybe that's just my projecting, but
Yeah, sometimes, some people they have decided ahead of time this is how far they will go, and they are within their mental capacities to, as they are seeing what's happening to them and still capable of decision making, they can say, no, I see where this is going. I don't want to go any further. But many times you don't have that.
yeah, that
That
luxury.
luxury of being so conscious and decisional
Yeah.
to do that. So that's and then some families, like spouses, it's hard to see, even though if they have it all written down, especially if somebody's under the age of 60, kind of hard to see that. But we
Yeah.
respect their decision, right? So it is not my values that can be imposed on somebody else's, it's their value. So, and
So
that
you
can
see
also
that.
be, I see, not just like my approach is always like, you can't support, if you can be brought back to your pre-event uh, quality of life.
Mhm.
And again, depending on how every adaptable that person is, I mean, if I can't get here, then I don't want the interval care in between.
Yeah. What you're you don't have a lot of fear, do you?
Oh, I'm afraid that, I'll be honest, I have discussed this with my close friends. Um, I have not like had a sit down with my kids to, tell my daughter. My daughter is the adult now, so she would be involved. And, something happens to me as I'm driving out of here. I have in some conversations, but no, I haven't really sat down, and I do need to. I mean, one of the person I have kind of designated, still not on paper, so that's bad on me.
Yeah.
She knows exactly how I feel. So, and she's a colleague who's also an ICU physician. So,
Mhm.
therefore it's easy,
Yeah.
I think. But they know. But I sometimes wonder how difficult it is for kids to hear from there. Suddenly, even no matter how old they are, you bring up this conversation. It's almost like they're facing, oh, mom's uh, something's going to happen to her, or she's not telling us something, and she has,
Oh,
so
yeah,
yeah,
right.
yeah.
They're
So I would
people.
just tell them, and this may be hard for you, but this is what I want, and then so and so's, we work together, so they can make that decision, and they know what I want. So I have that ability to help them. But yeah, when the kids are younger, it's kind of
Yeah,
can be tough.
that's tough topic. What do you think in general a good age to bring it up? I mean, how soon as not for the necessarily the age of your children, but like the age of yourself. Like when do you think it's a good time to consider it?
I think anytime. I mean, if you have a significant other or somebody else, and if you have strong opinions about this, then I think they should be known. But otherwise, we always assume, normal life expectancy is, I think it's like 75, 80. So
Wow.
everybody should be allowed to live up to that age. So if something happens to somebody in their 50s, I mean, the answer is, I mean, depending upon what it is, right, that they are ending with, that we all hope to live to that age. So I would say, you have kids and you have, even if you don't have, this is something that can happen to anyone walking out the door. So just, this is,
It's a worthwhile
it's a
conversation
worthwhile
at
conversation
any
to have as
age.
to what is the quality of life. I would at least like to, up to what level will I compromise? I mean, even if I can't get up to where I am now, but, can I function without a limb, a couple limbs, or, if I'm on this or that? Yeah, so that's a conversation.
Yeah. Yeah,
You're not a fun person to be with,
yeah,
very morbid.
you want to be fun to hang out with. That's yeah. I mean, otherwise, I don't disagree with you. I mean, I would definitely want to be able to enjoy myself. Otherwise, what's the point? At any age, I mean, you have to enjoy life, right? Fundamentally, I believe that's
Yeah.
that's part of us. But my son was asking, I don't know why. Well, when I'm 40, how old will you be? And we told him, and he got really upset, because he does, he knows how old Nani is, and she's not even close to how old I would be. And it's like, how do you have the wherewithal to even care? And then, I kind of wonder, like, maybe it's a conversation I do have to have while he's younger, maybe in his 20s even,
Oh, yes. Yeah.
because he's so nowadays we were tricked. We were told not to have kids until we were 30, because you have to like live this life and pursue your dreams. And I feel like it's such a hoax. I feel like the life is the dream and you got to live it to the fullest.
At whatever age, I mean, I guess there are pros and cons to that. I agree with the, you know, achieve to some degree and then have kids. But then, yes, you are the older parent in the group. Like my son told me, you're the oldest parent. You know that, right? I'm like, really? There aren't anybody who's got older kids and, their high schooler is their youngest and they're still younger than me? He's like, yeah, because you had me when I was when you were 40 years old. I was like, yes. Mm.
You're getting you're in
Yeah,
trouble
so
for
I
it.
was. Yes,
Were
I
you? I didn't
am.
realize that. I would never guess that. Is that
Yeah.
true?
Yeah.
Wow.
I was 40. Um,
How
yeah.
was it? My wife was. They said that you're geriatric at 35.
Oh, that's right. I was geriatric, and I don't know what made me want. I think I wanted Sonali to have a sibling, and but by the time I
You have no fear.
decided, yeah, no, I did go through all the right procedures to make sure that there wasn't, um, that
Yeah, it was
we
done
had
well.
that.
You did all that
Yeah. I
exercising.
did. No, not that. I mean, I think we had, what was it called? Like a, um, uh, oh gosh, I'm forgetting the name. When they analyze the fluid and the
Antibiotic fluid.
placenta and
Yeah.
stuff, and so to make sure that the kid that is not doesn't have any congenital anomalies and stuff because
Yes.
of my age. So
Yes.
yeah, so I went through that with the full intention that, again, I don't know if you want to say that on the podcast, but
Yeah.
yeah, I was not going to continue a pregnancy with if there were some anomalies
Yeah.
based on my age. So this was like this one chance. Yes, if this didn't work out, then there would be no kids.
Well, you see it through. I mean, you would know better than anybody your risks and
Yeah,
yeah.
yeah.
So wow, I did not know that. So I have a question that I've been wanting to ask a doctor on here. So both of our pregnancies both of the times Maria was pregnant was pretty like scary for us. And I don't know if it's age and predispositions. But so when our son was born, he was like 48 hours. and he was, I guess, sunny side up is
Hmm.
the way they put it.
Uh-huh.
Like
I
he
don't know.
came out basically like neck first, like his head was back. So they were saying there's like no way he would progress. So like after she dilated to a certain centimeter, maybe it was 3 or 4 centimeters. No matter how much is it pitocin or
Mhm.
what other chemicals that she was given to help, constrict and to dilate, uh, she wasn't gonna progress. So they had to do a cesarean section. And I'm just wondering, like, because she was in labor for such a long time.
Mhm.
I'm sure they had like an ultrasound machine within 10 yards, 20 yards. Like, why don't they check to see the orientation of the infant and just make a decision instead of like not knowing? Is there a reason? Like, is it?
Oh, I guess this is a question for an OB, so I
Yes, I
shouldn't
had an OB
even.
on here too,
Yeah, I
but
wouldn't. I would say I should probably not. I don't know. Is the best answer because the last time I did OB was
am I
eons ago.
am I thinking like a construction person and not like
Yeah,
a
because
like?
things get, maybe they might have thought that as labor progresses and, that the orientation might change. I don't know.
Okay,
But yeah.
I wonder. I just seem like, and then I was asking, and it's like not a common thing. Like it's not done. So I wanted to ask a
Oh,
doctor, like,
I
why don't
see.
you have the machine right there? Just see how they are situated, and then you'll know if a
Uh,
cesarean section is
is
needed
needed or
or
not.
seems
So
obvious. But I don't know. I just, you
talk
know,
to a high risk OB and they
yeah,
might be
they'll
able
have
to
some
answer.
answers.
Yeah.
So you do respiratory as well,
Yes.
and that's not in babies or children. It's
No, no,
typically
just adults.
what's the difference then in is it schooling or just focus, or is it the same schooling and different focus?
In terms of,
Um I guess what do you is it a decision that you don't treat infants, or is it just a totally
oh,
different
yes, yes.
department?
It's a completely different department. So, when I did my training after medical school, it was in internal medicine.
Hmm.
And so it was adult medicine. So over the age of 18. So kids are very different, different stages. So you have to go into pediatrics and then do a pediatric residency where you're treating children 0 to 18.
Yes.
And then you specialize also like all, there are parallel specialties like there's pulmonary for pediatrics and endocrine pediatrics and infectious disease. So all of that are parallel. Children are different. There's
Yeah.
medication dosing is different and so on. So yeah, I went into adult medicine. So we learn everything in medical school, both adult and peds, and then you make a decision whether you want to treat the kids or the adults. Some specialties like allergies, there's a little overlap, so we might treat kids with allergies.
Okay.
But most of the time, it's either or. But then there are residencies called internal medicine and peds. So therefore, they are learning about both sides and
Was that your focus in
adults only.
internal medicine?
Yeah.
Was it singular?
Yeah. So after medical school, I did an internal medicine residency. And then I did a fellowship training. So the internal medicine residency is 3 years, fellowship was 3 years. I did do another whole set of training when I was back in India, but when I came here, I applied for internal medicine.
How long were you a physician and were you a doctor in India?
Yeah, so I practiced ophthalmology briefly. So
What does
that's
that mean?
the eye, taking care of the eye.
Okay.
So that
Your
um,
eyeballs.
eyeballs,
Okay.
yes.
Oh, yeah,
So
optometrist, right.
you know, right. So I just felt it was suddenly I didn't realize I liked the subject, but I felt it was too over specialized. Like I wasn't able to treat someone's high blood pressure, for example. But I can treat their glaucoma, but I don't know how to treat the high blood pressure. So it was a conscious decision to not continue that training when I immigrated here. So I decided to switch specialties at that point to internal medicine, and I am very happy with that.
How old were you when you came here? Can I ask?
Yeah, so I was 27.
And then you had to start basically, or was anything
No, so
transferable?
your medicine into so your basic medical education is
Mhm.
recognized, and most countries recognize each other's medical education, but like the subspecialty or specialty training has to be done in the so
The nation where
yeah,
you're
in the
practicing.
nation where you're practicing. That is also changing to some degree somewhere in this country, but for now, that's the practice. You come in, you apply, and get into a residency program of your of whatever specialty that you want,
Hmm.
and then you continue specialization, or or start practicing.
So, did you always want to be a doctor?
Always, I
Really?
think, from it was fascinating going to the doctor's offices when I was a kid with anything, a sore throat, fever, and we had this these physicians in the neighborhood, so where I lived, and so down the street, again, it was somebody's house, and one room was turned into their clinic,
Hmm.
and there'd be all these people waiting outside with all kinds of problems. You get into um, the office. I loved sitting on that little round stool with the rotating head.
Hmm.
And I was just fascinated by that. And then one of these doctors was a woman. I don't think I, at that point, understood how fewer women are in medicine as compared to men, but it was just like fascinating that she scribbles something on a piece of paper and we go and buy it and then we get better. And then so that was I was always fascinated by it. So I somehow always wanted to be in medicine.
Ever since you were little.
Yeah, it was 8, 9, I think. I don't know when it was started, but yeah.
How was medicine when you were little over there? That it's compared to now? Does it seem?
It's pretty rigorous, and I think I had the best training because a lot of it was focused on physical exam and making a differential diagnosis, and I think that aspect is diminishing in both in my in India as well as here, where I think they say we are more and more interested in writing what the patient is saying. We don't even look at the patient. We are busy typing into our thing and looking at them,
Hmm.
and then we look at them, and then yes, so we kind of
Yeah,
um,
you lose that
we lose that patient
intimacy, kind of.
physician, yeah, looking somebody and talking to them and spending time, and some of it is also driven by how many patients you have to see per hour. So I can't sit and talk to somebody for 45 minutes unless they are assigned 45 minutes in
Yeah,
clinic. And so that, I still enjoy that part of my practice is, talking to the patient and understanding. And, um, but that is diminishing, and we those in education, medical education, kind of do realize that, and at the same time, it sometimes is something that has to come from within, I suppose. So we can keep telling the new people getting into medicine to not forget that. Don't forget your patient. Just
yeah.
talk to them and write your notes after. But it's hard. It's for their work-life balance. They're seeing 20 patients in clinic and then spending 4 hours after clinic writing their notes. That's causing
That's
burnout.
yeah. What about like AI?
Yeah.
Do you see that? Is that coming in now? Because it seems like it's pretty
Yeah, it
good.
is coming in. So I think I just heard like the system that we use, one iteration of it. I don't know if it's when it'll come to my institution, but it can just have the patient talk as you're talking to them. It's kind of listening and transcribing and turning it into a note, which
Hmm.
is awesome. I think so. AI is. I mean, that definitely is a good feature. I would say that if I can then look at that note and edit to the best, and and collect all that data without with my typing skills. So I didn't learn typing when I was in school. So I'm like trying to type and I'm not typing and I'm writing something that I don't understand what I wrote afterwards. And so yeah,
Right.
so will be helpful, and it is getting integrated in
It,
some place.
it probably will help too, because then I think that's how much time do you think? Is it half the time you have to spend documenting?
Oh yes, definitely. For me, yes,
Yeah,
it is half the time.
that's probably pretty standard, right? So maybe if you can get it down to like 10% of the time or something like that with AI or
Yeah.
so.
I mean, there are other ways, like, you create short dot phrases and stuff to make it easier, but then it becomes more of a templated kind of note as opposed to what the patient is actually telling you. So I
Yeah.
think, yeah, there's definitely beneficial to have that. I haven't used it, so I can't say how much it's going to save me time. But
Yeah. Is that something that's provided by like the building that you're in, or like how
oh, no,
does?
so it'll be with the software, the electronic medical software. So it has to be, secure, HIPAA, all of that.
Right. So it takes some time, and then
Yeah, I'm sure it costs a lot. So it's kind of, to depending upon the size of the practice and the cost. And so it is. I mean, there are low fidelity versions, like there are scribes. So some practices use like, you're dictating the note to a person who's in the
yeah.
room and kind of like a typist taking notes. So they write the note and then you look at that. I mean, we have dictating software. So there's
Hmm.
Dragon that I also use.
Yeah.
So I can just dictate and I don't have to type. At the end of the day, I often wish, yeah, should have just learned typing.
Well, it's gonna be gone. You're not ever gonna need it. I bet
That's
the
right.
insurance companies are investing in it, right? Because I'm sure anything they can use to get more through the door, or however you want to put it.
Yeah. So,
I don't
that's
know.
the other thing. Now we went from um, 30 minutes to 60 minutes, 30 minutes for the return, 60 minutes for a new, to where it's now 20 minutes for a return patient and 40 minutes for a new. And so now they'll say, well, AI is dictating your notes. So now you can see a patient in 5 minutes. And, so I don't know. So yeah, as long, you know, that's a topic for another day.
Yeah, yeah. I'm sure that's always a hairy situation.
Yeah.
Um, I mean, if you deal with the ICU a lot, how do you handle like yourself? Like, I'm under the impression, because I'm my own person with no real expertise, that like all health is health, like mental health and physical health, in my opinion, are very synonymous. I don't understand how to separate them. Um, like is there anything that you do or need to do to like unwind or unload, or like how do you handle being around it? Like how do you have peace with it for yourself?
Yeah, I will say it's not easy. It gets maybe easier as you, see a lot of it, or as you get older. But maybe now that I'm older, I feel like, oh my God, this is what I have to look forward to. So there can be some angst with that. But at the end of the day, I think, I come home to my kids and interacting with them. That's relaxing. Trying to do stuff that for yourself. Like I exercise and enough, so I will try to do something when I come home. The work-life balance as a female physician, single parent. Oh, that's
That's
heavy.
that
Yes.
is, yeah, that's a mouthful.
But
That's real.
yeah, so I think you have to be aware of that. Like, if the work stress is getting to you, then it's important to recognize the signs and kind of step back and take some time off for yourself. So I think, taking breaks, I do take vacations that I'm allowed, and I like to travel, so that is a good stress relief. Um, but I think trying to be kind to yourself and not be like, super mom. I mean, we see this all the time now that you're bombarded with. how to clean your house on reels and how to do this, everybody's telling you something,
Yeah.
and thereby the assumption is they are doing it better than what you're doing. So that adds to more stress to me these days, because my feed is all about how to strengthen your knees. I'm like, oh, so what I'm doing is not right. The more I watch, the more I feel uncertain.
Self-critical.
Yeah, yeah. So I think it's helpful to kind of accept what's important and kind of writing that down. If spending time with your kids is important, and therefore that takes time away from cooking, so kind of having some workaround for that would be helpful. Um, because if I also have to work, I have to come home, and they should be like home cooked meals, and then I also have to spend time with my kids and then get myself ready for the next day. Sometimes that can be very hard, but it does affect me. I don't like to see come to a messy house. I want the house to be clean. And sometimes my kids feel the brunt, especially as they've gotten older.
Yeah. Well, I mean, if things are organized, you can relax. If you like, you can't relax. It's like chaos in your house is chaos in your mind. I mean,
Very true. Very true. Yes. So that's so that's key. So sometimes, it may be less in your pocket. I feel like if I had prioritized, like cooking takes a lot out of me, but at the same time, I don't like to eat out or order food. So I mean, somebody could come to the house and cook for me, and if at the end of the day, sometimes you feel like, oh my God, am I paying this much to this person when just so that I could do this? So you feel guilty of giving up that much, and I think you have to just come back to say, by doing so, what did that get you? I mean, if after that you're also sitting on your phone, maybe it's not, in my mind, it's not worth it. But so just
yeah.
kind of analyzing that, yes, you want to work, and you also want to be able to spend time, which means that you have to pay X amount more for this, the caregiver that you've hired, or, somebody, some additional helper to help you.
Yeah. I mean, I would imagine you would need a lot of help. I mean, I have a wife. I'm there. And we can't get enough help. I mean,
Yeah,
that's
so
a
I
big
think,
workload.
yes, it is. So I remember when in my, when I was looking, and I hate admitting that, but yes, I would find a nanny who would charge me less. So I couldn't. And people came with my jaw would drop. I'm like, what? I can't pay that much. And I realized, yes, I could. But what if I could get away with paying less? So
Well,
it's um, and that's always, but sometimes, so therefore, I think finding the person who could do, who you're comfortable with, but maybe charge a little more, but may take away some of the daily chores, I think is a worthy investment if that gives you peace of mind. At the end of the day, money is, as long as you're able to meet your basic needs, I think you have to have a good uh, understanding of your budget, and how much you can stretch it,
yeah.
and if it's worth that stretch. So that's the justification you have to make, and you have to be comfortable with.
Yeah. Well, money's a tool, right? I mean, it's a tool.
It's a tool that can, I won't deny it. It buys a lot of comforts, and it's not nothing. It's many things. I mean, I am constantly aware of the fact that growing up, we didn't take any vacations, or we took a vacation in 5 years, and I take sometimes 3 in a year now.
Well, you need it. You deserve. Well, I don't know if you need it, but you definitely deserve it. Do you ever feel like you've been in maybe some situation with a client, if that's what you call them, and you say, I need a vacation after this. Like, this has kind of put me on my heels. Or have you kind of worked through so many?
Yeah, not really after seeing a patient, but I think um, breaking the stress by some time off, is definitely helpful. And it can be like a staycation. It's just like, doing something that you like, and it doesn't have to be a trip somewhere, but I like hiking or I like going up in the mountains. So yeah, anything that'll get me there. Sometimes when I come back, there's always more work because it's whatever you didn't do that week didn't go away magically.
Right.
It's just waiting for you at the end of the road. So, but I try not to think about that. I have to consciously, like, oh, yes, all those clinics I canceled and added on afterwards, they're coming for me, but I still think it's worth it to take that week off and
Yeah.
go away. So I think, you know, breaks like that are good for your mental health, and everybody should take them.
Yeah. Um, and you probably don't know this, but Maria initially went to school for respiratory therapy, and
Oh, I thought
she
she was a nurse.
she was certified, and during her, we're gonna just say things that aren't accurate. I don't know. Do they have clinicals? I don't know what they
Yeah,
are.
yeah, they have.
So during her clinicals, um, I think she had to see some mortality. She
Mhm.
went through some death, and she was very put off by it. And she says no at that point.
Mhm.
And now, with Ava and different respiratory things that she had because she was born pretty premature, although she's doing fantastic.
Mhm.
She is like, maybe I'm supposed to go back, and maybe so she's looking to work, but she's also looking to get recertified. Um, and I just wondered if and that's something I'd probably ask any doctor or anybody that's in sort of the service industry that like of human health and well
Mhm.
being. Is that something that like is hard? Like, do you see that in like throughout the industry, or do most people that make it to be doctors already have kind of the proclivities to handle that sort of stress and they know what they're getting?
Stress of the illness of a family member.
Or like dealing with death on a regular basis.
I think that's uh, no. I think that's hard. Even if you've been dealing with it, when it comes to your own family, I think what my friend told me was that you should stop being the doctor. I mean, I think yes, you should evaluate, make sure you. The advantage I feel is that I can understand the medical lingo better, but I have friends who are not in medicine, but who kind of, with all the technology that's there and what they read, are still able to kind of ask the pertinent questions.
Mm-hmm.
But I think it still stresses you. I mean, my father, who passed away, had a pulmonary condition, and I could see where that was headed. But he probably, I think that's the other aspect of the. Uh, I think even though he knew, but I don't think he openly wanted to confront it or bring it out in the open, so to speak. So, but it was, I did know, my knowledge of that condition prepared me for the fact that, yes, he doesn't have a lot of time. And that these are the signs of worsening. This is what lies ahead. So I think that was helpful for perhaps my sister to know, or like when I could discuss with her that, and so on. But yeah, no, seeing death is not always just because you go into medicine. I think you don't sometimes are not prepared for that.
Can you
You know,
be prepared? Like,
I guess you have to know that everybody everybody who's born has to die,
right,
obviously.
right,
But I
part of the
think
deal.
it's part of the deal. So the goal is to see whether, you know, if it is inevitable at that point. I feel like the transition should be made easier, but I think, you just have to accept it. I think that's what I was trying to get. Like, I think you understand when it happens anytime. I mean, even now, when it happens to, I say that went into adult medicine because I can't see children sick. It's very hard. And I find that the most difficult part of medicine, even when I was training. So it was not for me, but I'm thankful for all the pediatricians that are out there who are there for my kids, right?
Absolutely.
So they get, their sense of service comes from making these little things better. uh, and um, and so, they can see a child who's having whatever it is they're having. I can't see any child even crying, and walking through the pediatric ward for me is like, oh my god, I can't imagine these poor things going through what I didn't have to go through, or that I'm the adult. And so yeah,
Yeah.
so it's different. So yeah, not I don't think I'll handle a kid's illness.
Yeah.
So
But an adult's, yeah, because I think she avoided it, you know? She says, I can avoid it. It's my choice. And then she avoided it. And then with birth, couldn't avoid it.
yeah,
And she was
but
kind of,
she's facing it. So now she
yeah,
is, so now she knows that she will do anything for our children. So
yeah. And now she's thinking, well, I do have it and it is in me. And maybe it's something that I need back in my life. Well, we'll see. I mean, it's up to her, obviously, but I think it's
yeah.
such a strong thing to get into than to just stop and say, no, this is something I'm not going to do. And
No, I don't think. I mean, it's always good. Just because you walk down a path doesn't mean you have to reach its end.
yeah,
If you decide that somewhere along the way, I think it's better to pivot and be adaptable, as opposed to saying, "Oh, just because I started writing this or doing this, I have to see it to completion." When you realize the toll it's going to take on you. So no, I completely, it's not necessary to go back. You have the background knowledge that perhaps will help in understanding that process and understanding and advocating for, your family member. But you don't have to go back into that profession. But sometimes people are motivated by that. It's the struggle. To enter medical school and to enter fellowship training, you have to write these essays called personal statements. And oftentimes I see, where something is highlighted that someone, you know, uh, some experience that they had that guided them to kind of go down this road. So, it could be that. It could be that first, the first experience of seeing you, yeah, you went into, again, as a 17, 18-year-old picking up a profession, really don't know, you don't see it. And then when you
yeah.
see it, it's kind of like, I
Oh
don't think I
boy.
can. And so it's okay to walk away, but then something else changes and kind of gives them a new purpose. And now they're older, they have more, fortitude, and they can complete that.
Yeah. Yeah. She's really smart. I mean, she really is. And it's so much a part of like her nature.
Yeah.
She's very analytical and very scientific. And she's always bringing things up. And when we were even in the hospital, like, are you a doctor? Are you, because she has the knowledge and it hasn't left her. And so many things she has just the resistance to have an opinion about and doesn't really care or think too much into or no conviction. And then anytime this sort of thing comes around, there's just so much passion behind it and so much livelihood, like liveliness in her. And you just see so much of her intelligence like be utilized that I hope
Yeah,
she
I hope
finds it
she.
if she decides to. But it definitely, if anything, I think it really helped her honestly stay alive through the birth of Ava, because I think
Mhm.
that was something that was very risky,
Yeah.
and was very scary for me, and she had to navigate it in like such a way, and really be her own advocate, because when you're in she was in the ICU or
NICU.
the
Yeah.
NICU, you see many different people, right? Because they check out and someone else checks in, and she had the wherewithal and she was really good with it. Um,
Yeah. No, it's, the illness of your child is can be very stressful. So with my son, when he was born, he had as I had a vaginal delivery, and he comes out and I don't hear him cry, and I was like, what's going on? And by that time they had figured out that his The cord was around his neck, I think. But it wasn't, to the point that I had to be rushed to a C-section. But I could see that he didn't cry, and I was immediately, um, obviously worried, even since I was conscious and so on. But
Yeah.
so he had to stay in the ICU for like 2-3 days for being monitored. He didn't require being on the ventilator, and so everything worked out okay. But it was pretty scary for those first, I think 72 hours. I think he was there, and I have a 7-year-old at home who wanted to see her brother, but I
Yeah.
was like, and he was overall okay, but it's pretty scary. So to go even that, like he didn't come home to when there's an actual illness, like they are in the ICU as
Yeah.
premature kids and so on, can be extremely stressful. So to maintain your objectivity so that you are there to support your child and to advocate for them, it takes, I find parents in that situation to be extremely courageous. I don't envy them for a minute. Same thing for other caregivers, even for my adult medicine. I mean, the amount of stress caregiving can cause is unimaginable. On the strain that it puts, I saw that with my mom as when she was taking care of my dad, and long distance caregiving also on my end was pretty stressful. So it does put a lot of drain, and so I think my views on what comes after are also affected by that. Not just, yes, maybe I'll come through this, but it may mean that I will need X amount of care. And what is that going to do to my kids and their lives? So those are all the thoughts that
Oh, yeah.
come into being.
Yeah. Creativity starts to, it's your friend, but it's also, yeah, the variables really become apparent. Um, I'm wondering, do you notice if you're in the ICU, is that, and I don't know much. As you see, is it only elderly people? Do you have
Oh
like
no, we have
trauma come in, or?
so I don't take care of trauma patients, but there is surgical trauma, all of the accidents and stuff. So that's a surgical critical care. I don't do that.
Okay.
And but we do see younger people. I mean, even with an infection, you can end up with a low blood pressure that requires an ICU stay till they are stabilized and they get antibiotics, um, so it's not always the old people, but um,
Was
there are young people
was
too.
COVID a big part of your day to day, or was that
Oh
kind of
yes.
outside of your?
No, no, no. It was a huge part of my day to day. Yeah, that was the most stressful time of my life. I think that I can look back at it, but it was stressful on many, many fronts. Um, an illness that for the first time, I think I read it somewhere, but we were always used to wearing, within certain infections, you have to gown up as opposed to just washing your hands at the door and examining the patient. But this is where almost like the patient's illness could potentially kill me at that
Oh,
point.
right.
So that, and at the, you know, so for me personally, I think being the only parent, and so taking care of COVID patients and then coming home to my two kids, and the cleaning ritual that I would every day was, I just didn't think about it. Like, at some point I wanted to say, okay, I better start assigning who's going to be who's going to take care of them if something happens to me and what needs to be done. And so yes, those days I can look back and say, well, I'm glad it's we have treatments, and we have a vaccine. and
Yeah.
we don't have to worry. But that was very stressful. And those days, seeing, you know, healthy people with no other conditions, succumb like flies, it was devastating. It almost felt like it didn't matter how much I exercised and ate healthy, but I could just get this, and such a communicable disease. I could be in the same room with somebody who doesn't know they have it, and I will die.
Yeah.
Or
Oh,
if not die, but be incapacitated to the point that I will not be able to support my family.
right. Or you wash up. Did you go home and wash up every
Oh,
day, or would
yes,
you?
every day. I was living in a place where there was a walkout basement, and as soon as you enter the basement, there was a shower. So the kids were not allowed to come down to, till I had completed that process. So I would shower, and it was like shower, wash your hair, is like as if it was stuck to my hair every day, which is not something I was used to.
And the
And then
groceries get the same scrub down.
yes, and so I would do my lawn. I mean, unfortunately, I didn't have a second laundry. I couldn't burn the clothes. So yes, we would wear scrubs, and those scrubs would go in a plastic bag, and they would be taken back to the hospital, and the hospital will clean it. So it was
Okay.
like we wouldn't take the clothes that I wouldn't wear the clothes or bring it up to my bedroom to put back. Shoes were different. Everything was left at home or left at the door. So you can imagine, after, working 12 hours, you come home and you have to do this ritual before you can go hug your kids, or, so
Yeah.
extremely stressful.
Yeah. I bet that. Um, I could ask, how was it like amount of patients? Are you? I remember seeing
Oh,
videos and
yes.
they're
I mean,
saying
we
like,
had, I forget at this point, we had designated ICU names from A to F. So we normally have A and B. That's our standard
oh
staffing.
wow,
And then we went from A to F. Um, and everybody was mobilized. Yeah, it's PTSD talking about
what was?
it.
I know. Like initially, it was like we don't have enough ventilators. They're
Yes.
like three
Yeah.
manufacturing ventilators, and did that did that help? Did it
Luckily, we
not
didn't
help?
get to that point. But yes, we had to have our ethicist, yes,
That
kind
this
of
is
help us walk through, this is the pathway, this is how, we have to prioritize. You can't say that it's just because you're old and you deserve to die, and the young person shouldn't. But yeah, we had created flow charts and stuff to figure out how we would, what, you have all of these conditions, then it might be too late. And so it might be worth not putting them on the ventilator and giving it to this person who has just come, and so on. But luckily, I would say, knock on wood, I'm maybe one of the few lucky ones, that we never had to make that. I never had to make that decision of,
yeah.
but there were places that did.
What about the process of like the procedure to the disease? What was that? Was that something that was like
I mean,
brought
I think
in or?
we were learning as we go. So that was the thing. It was kind of everybody mobilized, and it was an international effort. It was not just us. So I think, we would have everybody was, somebody's job was to collect all the information and kind of pass it on, and then as treatments became available, but most of it seemed to be like supportive care. I mean, yes, there was remdesivir, and then there was Decadron, and then there was other medications that were just being tested, and without what we considered the gold standard of testing. But we were desperate, so we were taking what seemed like reasonable data at that point, and trials were ongoing. Um, and so yeah, so that was also the other issue. You somehow think you know how to treat a problem, but then you're confronted with something that now you don't know how to treat, and you got to figure out. And
Yeah.
yeah, so all of that was I mean, that vaccine was like, oh my goodness, I still remember. I can remember the day, the moment, what I was wearing, where I was when I got that vaccine.
Glad for it?
Oh, I don't, I think my life changed because of it. Like, it's not, I had something. I had my own body fighting.
Yeah.
And yeah, the minute I could get my kids, I let them have it.
How was the how did the media, how did you feel about, like, did it affect you at all? Like, what was it was saying about things, or did it
Those days, the media was not, at least I was listening to, there was good guidance from the CDC and Dr. Fauci and, what was being reported. Yeah, seeing the extent of the problem was sometimes this, it's like, when will it come knocking my door? It was
yeah.
already there, but, the extent in some areas was much higher and so on and so forth. So all of that could be depressing, but at least, we had some reliable resources. The CDC website was kind of like a lifeline. Yes, you would always have that. You can pull it up on your phone and you can see if that something's changed or not. Um, so yeah, that guidance was valuable. So where we are now, I don't know.
Yeah, what happened? I mean, everyone seems to like think Fauci's like an enemy or something. Like, at least that's how I see it
Science
painted.
guy did the best and
Right?
did the
Like, it's,
best job.
you got to do the best you can, right? It seems like you're kind of,
Oh, he did the best. I mean, it's just,
if you do nothing and you don't put anything out, everyone says, "Well, what do we have all this for? What are you doing?" Then you put something out and they say, "What are you doing? You should not have put this out."
yeah,
Right?
don't put the,
It's
Fauci stuff probably podcast. But,
yeah, it's
I think we need guidance. And I think that's why we uh, put people who put science first before politics. And
yeah.
science is science. Science should not be politicized. It is facts and figures, and it should be treated as such. And it doesn't matter. I mean, you can have opinions about, politicians, politics, policies, but science is not up for debate. And I think there are treatments that follow a process and have been tested and tried, and therefore they are made available. It's not, um, tomorrow I'm not going to take an herb from my garden and call that the cure for cancer and be able to say no. You have to have it. I mean, there's a reason why there is scientific rigor and protocols. I mean, to completely ignore that because it doesn't, I don't even know how we got to this point where science is politicized. I mean,
Yeah.
and it should even not be on social media. Science is between you and the physician. And for somebody to come to your office and say, oh, I saw this on XY media. What do you think about that? I mean, yes, it's okay to ask a question,
Yes.
but you should be able to accept the answer to say it's not being tested. So I don't think it should be tried. And as your
Yeah.
physician, I don't think it should be tried, should be something that should be taken for that value of the person who's the specialist. um, and and therefore, you know Google Doctor is not AI, is still requires things to be signed off by a human brain, and I hope that stays forever.
Yeah. Yeah, me too. As soon as we can.
Yeah.
Oh, it is interesting though. I do think you're right. Like, it should not be political, right?
Yeah, you can
Absolutely.
talk about face creams and foot creams and, make TikTok videos about fashion and, or whatever, social media thing, but don't put in, medical opinions. And I, I have opinions about, physicians going into social, I mean, as long as it's scientific based, spread the knowledge, but do not, you know, don't some because something worked for you doesn't mean it's a cure for all, and it's harmful or to broadcast that. And
Yeah.
so people who are, this is a media that has to be taken responsibly, and to spread ideas and treatments that are fake and just because it makes you popular is a crime, and it should be treated like that.
Yeah. Yeah, I think it's hard that specifically that. I don't disagree with you. I mean, ideas can be very powerful and weaponized and utilized, and look at history, culture and caused genocide, and now it's like at everyone's fingertips. And it almost seems like impossible to police, because then it like a moral conundrum. Everyone has allergies for one reason or another. It's like you have to realize, I think, anything you see, kind of got to take it as entertainment. It's not real. And it's like, it's hard to not give credibility to what you see with your eyes, because I feel like there's a part of us in humor just believe what we see. It's so hard not to. And even though it's so fantastic and like outrageous, some of the stuff that you're shown, like a part of you wants to believe it. Not even medically, or just like interesting things, and then you realize it's all a facade, and it's just clickbait, and it's because someone's making money, because it makes them popular, because they
I
get
think
a
it's
following.
exactly. So I think that's the culture that's being promoted, right? So there's no turning back now, but I think it's awareness that just because you respect X person's opinions, or you like their likes are similar to your likes. I mean, that still is places to visit, how you wear stuff, or how you do certain things. But when it comes to opinions about somebody's health and science, I think that should be taken from someone who's trained in that. And you should understand the difference between, be aware of the difference between, this person's specialty seems to be, let's say, in the fashion industry. And so just because they have their opinions about how to take care of their health, they are not physicians. So if they choose to treat their ailments in a certain way, that doesn't replace your doctor for them.
Right. Yeah, they don't have years of empirical knowledge. They
No.
have strange concepts that they formulated,
Yeah.
which
Yeah.
is fun. But yeah, I agree with you. Okay, well, it was very great having you on. Thank you for coming, and hopefully you come
It's
again
nice to
soon.
talk about some stuff, but yeah, might have some editing to do.
Okay, all right. Thank you.
Oh, great.
Bye bye.
Thanks for having me. Yeah, it's always nice.
Thank you everyone for watching. See you soon.